Hi, I'm Makayla Witt, an occupational therapy doctoral student at Eastern Kentucky University, presenting my capstone project titled Exploring the Benefits of Occupational Therapy in Women's Health. The ACOTE focus areas for this capstone project were education and advocacy. Over the course of the last 14 weeks, I worked in collaboration with OBGYN Dr. Byram Ratliff at Sterling Women's Health in Mount Sterling, Kentucky. Through this collaboration, I was able to learn and familiarize myself with the process of individualized women's care. The primary goal of this capstone was to educate healthcare providers, patients, and facility staff on the role of occupational therapy in women's health. Other goals that were addressed throughout the project were to observe my site mentor in treatment and to identify questions and areas of need to survey patients and their perception on occupational therapy services in women's health, and to create an online resource manual for patients and staff to enhance advocacy and education for occupational therapy services in women's health. During my initial stages of research and planning for my applied leadership experience, I noticed that there was an increased need for bringing awareness to women's health and how occupational therapy can support the transition based on different life phases for women. Due to there being a lack of research on occupational therapists' approach to women's care. According to a women's health article, OBGYN clinics address a variety of health concerns, such as infertility, special procedures, menstrual health, prenatal testing, and contraception. To deliver individualized care, OBGYN providers collaborate with nurses, psychiatrists, social workers, pelvic floor physical therapy, and oncologists. To understand how occupational therapy's role is relevant in this setting, I needed to be familiar with the sequence of steps for providing care in a women's clinic. I did this through shadowing my site mentor. In doing so, this allowed me to identify where there is a lack of knowledge through providers' care, through patients, and through nurses in occupational therapy's role. The next approach in my project methods was to survey patients, staff, providers, and nurses at the facility. I created an online survey. A sample screenshot of the survey questions and layout can be found in my poster. The survey questions were developed in collaboration with my site mentor and research from my literature review. The survey was available for 3 weeks and posted around the clinic, in treatment rooms, and at the front desk. Patients were informed of the survey prior to leaving treatment rooms and provided with a brief description of the survey and project goals. Patients were also notified that results would be completely anonymous. From the survey, I had 10 participants. Of those 10 participants, none of them have ever received occupational therapy services. 5 out of the 10 participants were not aware of how occupational therapy can support women's health. The 10 participants all selected that they had experienced or have experienced conditions that are commonly treated in a women's clinic and that could be addressed by occupational therapy. Those were mental health concerns, chronic back pain, pelvic floor dysfunction, breastfeeding complications or concerns, disruption to sleep and daily routines. 6 out of 10 participants would seek OT services to address those conditions stated, and 4 of the participants responded maybe. When asked why participants would not consider occupational therapy services, all 4 participants stated it was due to a lack of knowledge about occupational therapy. The survey results confirmed that there was a lack in understanding of occupational therapist role, which led to the development of an online educational resource manual. The online educational resource manual was provided to the clinic and posted in treatment rooms. That is embedded within my poster. There is also a QR code to the left that you can scan with your mobile device. Some key points listed were how occupational therapy can address maternal health, pelvic floor dysfunction, chronic back pain, and mental health concerns. An article by Seagraves et al. States, occupational therapy can improve postpartum outcomes by addressing pain management, positioning, mental health, lactation, and more, through client-centered occupation-based interventions. followed by a description of when patients should seek occupational therapy services, which states if they notice a disruption to activities of daily living, have pain or fatigue that limits their ability to participate in tasks, experience concerns during pregnancy or postpartum, such as back pain, breastfeeding complications, and more. Some implications for occupational therapy are implementing on-site occupational therapy services at a women's clinic. This can improve postpartum and other common health concerns with the use of client-centered interventions, supportive resources, and early education. According to a Women's Health article, a single 6-week follow-up appointment with an OBGYN is typical after discharge. Thus, mothers have limited support, guidance, and education for the postpartum recovery period. Educating providers and staff on occupational therapists' role in women's health to increase the lived experience and barriers that women may face within this population. An occupational therapy evaluation following childbirth can maximize recovery, reduce associated pain and impairments, as well as engage clients in interventions that support their daily routines. In summary, OBGYNs, facility staff, nurses, and patients at the women's clinic lack in knowledge on occupational therapists' role within women's health. Furthermore, there is a lack in knowledge about the profession within the community. Occupational therapy can contribute to an essential role within women's healthcare settings. Through this project, education and advocacy were provided to increase the awareness of occupational therapy and the mission to promote client-centered interventions.